I'm Camille Vizcara.
Ako po si Michael Angelo Corpus.
Ako po si Mami Lucy.
I'm John Adrian L. Manzano.
I am Rajami Malibago.
My name is Carlos Pizarro.
I am Dr. Joanna Javi Herrera.
Nung bata po ako, syempre po minsan parang nagkakaroon po ng mga questions na bakit kaya ako may sakit, bawal ako maglaro sa labas, bawal ako makisali sa kanila, ganon.
Sa taong 2016, na-diagnose po yung nanay ko ng squamous large cell. Stage 3 na po agad yung kasi nung una hindi niya pinapansin kasi akala niya masakit lang yung puso niya.
Ang anak ko pong si Darwin Kaluntad ay na-diagnose na may cancer sa dugo, leukemia. 7 years old siya nung ma-diagnose. Sobrang sakit kasi nung time na ma-diagnose nga si Darwin. Sobrang hirap kasi nga solo parent ako. Unang-una, hindi ako nagpapakita kay Darwin na umiiyak ako. Kailangan kong maging matatag. Kasi pag pinakita mo sa kanya na umiiyak ka, iisipin niya na hanggang kailan yung sakit niya.
Naalala ko, butot balat na talaga siya. Halos, alam mo yun, nagtititigan na lang kami. Ako, nagbabarker lang ako para makakabili kami ng lugaw.
Sobrang taas daw po ng lagnat ko and hindi daw po nawawala yung lagnat ko palagi. Then sabi po ni Lola, parang hindi na daw po normal. So yun nga po, pina-check up po ako. And nalaman po nila na yun po, may cancer nga po. Yung at such a young age, nakikita niyo po yung sitwasyon, yung harsh reality nga po, kumbaga, and yung death. So, kinukwento po ni Lola na nung time daw po na yon na kailangan na po magpagamot, tumawag daw po siya agad sa tito and tita ko po na nagtatrabaho po sa abroad. Padala po sila agad ng pera para po panggamot. Sobrang thankful ko po sa kanila dahil po sa kanila, napakadaming tao po yung tumulong para po makasurvive ako and mabuhay po ako. Talagang naduktungan po yung buhay nga eh.
Gusto ko maging malakas, gusto ko maging matatag parati. Kaya lahat ginagawa ko para sa kanya. Sobrang natuwa ako kasi maraming tumulong sa amin. Sabi ko, mahal na mahal ako ng Panginoon kasi kasama ko pa rin si Darwin hanggang ngayon.
Mga matatanda yung nagkukumpulan sila, nag-uusap sila. Ang usapan nila ganito eh. May tirahan dito sa Maynila, pwede sa mga may sakit. Pinunahan ko na agad yun, sinabi nilang shelter. Tapos, pagpasok ko doon, pag nakita ko may isang lalaki doon, binigyan ako ng tinapay. Ang laki talaga, sobrang laking tinapay. Kumain ako noon, first time ko na. Alam mo yun, nabusog talaga ako. Wala po talaga, wala kang trabaho, wala kang pamilya. Gutom po talaga. Yun, sinabi agad ng social worker, sige punta ka, dali mo dito yung mama mo. Punta na ako kay mama. Sabi ko, ma, may nakita akong bahay, laki talaga ma. Tapos habang nakatingin sa akin si mama, akala niya oras na yun, nababaliw na ako, bakit ano lang sinasabi ko eh. Buti na lang, sumama talaga si mama sa akin na nakapunta kami sa shelter na yun. Malaking tulong yun para sa amin at yun pong hindi ko makakalimutan talaga sa nangyari sa amin ni mama. May nakilala po akong kaibigan ko doon na si John L. Reyniba. At yun po si John L. Reyniba, cancer patient po siya ng PGH. Halos matagal na rin po siya nagpapagamot dahil sa cancer niya. Sa paa po yun. Kasi yung mama ko, di ba, ilang araw lang na maalam na rin. Tapos ako ang naging tumutulong kay John Ellie para pumunta sa PGH, ang mga check-up niya. Ayun, lagi ako kasama sa kanya, tsaka lagi niya akong sinasama dun sa Teen Barkada session na tinatawag, nag-usap-usap, sharing, itong karanasan ko, ganyan, ito ang gusto ko, ito yung plano ko, ito yung gusto ko marating, mga ganun. Marami kayong pinagsamahan dun, mga saya, iyakan, tapos alam mo, kalokohan din.
Nakilala ko po yung Circle of Hope. Meron po kasi silang support group po sa PGH, arranged po ng doctor, na nagvo-volunteer po sila na mag-lecture and magbigay po ng payo and nag-support po sa mga parents ng mga bago pong pasyente. And yun po na kinausap daw po ni Sir Rod, si Lola nga po yung first, and since grupo po sila, nandun po sila Nanay Lucy, yung other parents po na, and in-explain po sa kanila yung support group. And in-explain din po na meron nga po for teens. Wala po akong idea kung ano yun. And then pagpasok ko po, nandun na po yung iba kong mga kaibigan na mga nakasabayan and nakilala ko din po sa PGH. Parang nagulat po ako kasi hindi ko po talaga in-expect. Nagpa-plan po for Teen Summit. So parang sobrang happy ko po kasi parang first time ko makaka-attend ng mga ganon kasi usually nakikita ko lang po yun sa mga palabas, ganon po, since yun nga po, as I said, hindi nga po normal yung childhood na meron kami.
Tinulungan kami ng COH para makabenta kami, para meron din kaming income. Ang pinagkakaabalahan ko is yung livelihood namin, na yung dishwashing, yung mga beads na ginagawa namin, tissue holder, yung mga Christmas ornaments, yung ginagawa namin yun. Gumawa ng paraan din para meron din panggastos kami ni Darwin.
So, Circle of Hope started in 2015. So, there are 3 founders in Circle of Hope. There's myself, there's Dr. Rod Peñalosa, and there's Dr. Carlos Pizarro. So, the core of the Circle of Hope program when it started was really to provide support to the teen cancer patients. The Teen Barkada was really at the heart of Circle of Hope when we began at the Philippine General Hospital. We're a community mental health program, and we see mental health as community care. There were other parts of the program that were added, such as the parent support program, and we also tried to reach out to staff and did some mindfulness training for PGH staff so that we can provide support to the different stakeholders in the community and to the caregivers who are caring for the teen cancer patients.
It's not easy to sort of see kids suffer. It's always painful thing for see how helpless a lot of these families are. It's actually allowing ourselves to sort of suffer with them by actually feeling what they're going through and sort of sharing in their experiences, trying to help them express that. Maybe if they need to grieve, if they need to rejoice, if they need to just have somebody to listen to them, then that's what we do. We've done activities like the recorded songs, theater. When they're doing that, it's like being more human. I guess that's how I can say it. Being more feeling, being more aware of the needs of other people, and to expand my world, expand my horizon in terms of getting to know other people who are not like me, and to allow myself to feel and understand what they're going through. Cancer is a terrible disease. There's a lot more beyond cancer, and when we are dealing with people, with these children, we see more who they are inside, their potential, their dreams, their aspirations, and so we share in that, and we encourage them to go wherever they can go, to help them in any way we can.
learned about COH actually when I was having my internship. Inintroduce lang sa akin siya ni Doc Javi. Nag-work siya nun sa MedMom. Actually, yun ang bala kong mag-internship ako nun sa MedMom. Pero kinuwento sa akin ni Doc Javi since nung nalaman niya na taga Paco, Manila ako and malapit ako sa Philippine General Hospital or PGH. Inintroduce niya sa akin yung COH. Parang sinabi niya, pwedeng maging part yun ng internship ko. Tapos agad-agad, oo naman ako. Parang nasa isip ko na baka itong mga pasyente na nandito, alam ko matagal na sila nandito, baka naghahanap lang sila ng kausap. Nagpupunta ako sa PGH, which is every Friday. Tapos every time na magbe-bedside kami, kumbaga meron kaming ward na pinupuntahan. Kadalasan ang nakakausap namin ng mga teens, around mga sa nakakalima per day. Minsan mga 5 kids habang naghahantay ng gamot nila, kinakausap namin yun. Sa ganung paraan, alam nila na merong nakikiramay sa kanila. Hindi nila mafe-feel na nag-iisa lang sila. Sila lang yung nakaka-feel lang ganito. Sila yung may sakit lang na ganito. Ito talaga yung importance din talaga ng bedside. Kasi nakakapag-recruit kami ng mga teenagers. Saka sa kabilang banda, nagkakaroon rin sila ng kausap na someone na makaka-relate talaga sa kanila, na kaparehas nila ng nararamdaman nila.
Sa tingin ko po, kung hindi ko nakita ang circle of hope, hindi ko nahanap, sa tingin ko baka ngayon wala ako sa kinalalagyan ko. Wala akong ganun na mga kaalaman na meron ako ngayon. Kasi grabe, sa circle of hope, ang mga ate at kuya, grabe, sulit na sulit talaga yung kada session. Binibigay talaga nila kung anong pwedeng maitulong, kahit ano talaga, lahat ng nalalaman nila, binibigay talaga nila. At gusto talaga nila na maisabuhay namin yun sa araw-araw namin ginagawa. Kaya kung hindi ko nakita ang circle of hope, sa tingin ko, tuloy pa rin ang buhay, pero hindi ganito na may direksyon at may goal ako na tinatahak. Yun ang pagtatapos ko ng pag-aaral na may gabay nila ng circle of hope sa akin.
Kung ano po ako ngayon, para sa way of thinking or sa mindset, parang lahat po yun, napakalaking tulong ng Circle of Hope. Dahil parang sila po yung mga magbubukas pa po lalo ng perspective mo or ng way of thinking mo, ganun po. Dahil sa mga activities po nila and parang tinutulungan ka po nilang mag-grow. Siguro po, half po ng perspective ko ngayon or kung paano po ako mag-handle ng problem, parang yung half po nun, na-develop po siya sa Circle of Hope eh. Since napakadami nga pong activities and yung mga lessons po na nakukuha namin every time. Reminiscing po nung pre-COVID stage, nung mga umaattend po kami ng Circle of Hope. Sobrang saya po.
Pre-pandemic times, we go to PGH on a regular basis to be present with them, to do activities with them. So there's something about being together physically that is, you are present and they are present for you, that encourages you, wherein we encourage one another. During the pandemic, that actually just like, wow, what are we going to do now? We haven't really met with the parents in a physical sense because we also don't want them to be exposed. We don't want them to go to the hospital. However, because of technology, we are still able to do some work that has been made possible by their willingness to partner with us, and we make ourselves available for them. So pandemic has actually opened some doors that we didn't know exist.
So now that there's a pandemic, what has changed in how we provide our services and conduct our programs? Everything is happening online. We continue to provide mentoring groups to our teen cancer patients and survivors. We have our Kinaiya, which is our mentoring program. We meet with our parent support group for Hingalangin. We post this live. This is a live Hingalangin or mindfulness practice that we do with our parents at the beginning of each week. And we invite everyone, the general public, to join us in that practice. It's a practice of taking care of ourselves and also of being one as a community. going through these really challenging times. We also continue to provide online mindfulness-based support groups for fellows in the Department of Pediatrics at PGH. Their difficult work at the hospital. We're also producing modules, materials for communities in Tondo. We're hoping to produce materials that would help them take care of their mental health.
The COH group has really helped us to lessen our stress. We learn new approaches on how to deal with these cases, and to ourselves then we have our self-care. We are taught how to micro mindfulness practices. So all those has really helped our well-being as well as healthcare professionals, which we were able to extend to our patients. So the community has taught us to be less self-critical. So in a way, it has made me, I think, a better person, a better physician because of the practices that I learned in Circle of Hope. Ang laking tulong talaga ng Circle of Hope na community.
My most favorite part of what we do in Circle of Hope is really being immersed in community. It's feeling the heart of the community. It's the conversations we have. It's how people open their hearts to one another. And it's how you see people contributing to each other's healing, providing mutual care and support in the midst of a lot of challenges and adversity. Nothing beats that. Even if you peel away the layers of the programs we created or the structures, it's really the encounter. It's really human encounter. It's crossing the barriers that used to separate us. And now we are together, journeying with them, knowing their lives, them sharing their lives together as a community. So it's that encounter that is irreplaceable, invaluable. So take everything away, and we're left with that encounter that's rooted in compassion, that allows us to see each other, to be with each other, to be one human family. It's an indescribable gift. You are already part of this circle. We are one human family. We are all interrelated. We are all interconnected. And we invite you to take a deeper dive, if you will, by supporting our programs, our initiatives in a more concrete and practical way. And we'd love for you to experience what it's like to be part of this compassionate community.